negative curve, little rod on the run, with polar flagella that help it get things done. It lives in low oxygen and hugs the stomach wall. A catalyzing oxidase, positive drifter small. It slips through childhood pathways from mouth or from head. A fecal oral traveler that hides in stomach land. It settles in the mucus where the acid cannot bite. It trees makes ammonia and the pH starts to rise at night. Helicobacter pylori, the spiral in the dark. A gram-negative curved rod that leaves a painful mark. Oxidase positive and motile as it weaves. It scars the gut with ulcers and the stomach slowly grieves. It sends Cagate through a type 4 needle line. It hijacks host pathways and derails the cell design. Vacay makes the vacuole swell and tears the bonds apart. It loosens tight junctions and inflames the gastric heart. In the antrum it destroys the D cells that keep control. Somatostatin vanishes and gastrin takes the role. Parietal cells start growing and the acid floods the scene. Then duodenal ulcers march where the mucosa should have been. When it climbs into the body, the acid falls too low. Parietal cells diminish and the hunger pains can grow. A chlorhydria follows and the risk of cancer climbs. Metaplasia takes over in these long and quiet times. Chronic burning anger calls the lymphocytes to stay. A marginal zone uprising turns to malt along the way. Clear the bug and malt can fade, but leave it growing long. And gastric adenocarcinoma starts to write its song. Helicobacter pylori, the spiral in the dark. A gram-negative curved rod that leaves a painful mark. Oxidase positive and motile as it weaves. It scars the gut with ulcers and the stomach slowly grieves. A breath test finds the urease as carbon drifts in air. A stool antigen can catch it or a biopsy can stare. On histology the spirals rest upon the mucus shore. Never diving deeper but still opening the door. A proton pump defender keeps the stomach calm and mild. Then antibiotics pair up to finish off the wild. Triple or bismuth quad will clear the creature from its den. Confirm the cleanup later so it never comes again. Helicobacter pylori, the spiral in the dark. A gram-negative curved rod that leaves a painful mark. Oxidase positive and motile as it weaves. It scars the gut with ulcers and the stomach